From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about strokes, their risk factors, and treatments available for those who have them. Our guest today is Dr. David Stone, a vascular neurologist here at Sarasota Memorial. Dr. Stone, thank you so much for being with us.
Pleasure to be here, Allison.
Most people have heard of strokes, and they know that they're dangerous. But medically, what is a stroke?
Stroke is where there's a blockage of a blood vessel or rupture of a blood vessel that reduces the blood flow or blocks off the blood flow to the part of the brain that normally would deliver oxygen and nutrients to that part of the brain, and those cells die very rapidly. Another entity related to stroke that you might have a question about is a TIA, or a transient ischemic attack. That is where the blood vessel is blocked off, or there's not enough blood flow going to that part of the brain, and the patient has stroke symptoms, but then the blood flow is restored before permanent brain damage occurs. About 12 to 15% of strokes are preceded by TIAs. And you mentioned that they're dangerous. That's true. Stroke is a medical emergency and needs to be treated as such.
What is the difference specifically between ischemic and hemorrhagic strokes?
An ischemic stroke is where there's a blood vessel that's blocked off and blood flow does not go to that part of the brain. And a hemorrhagic stroke is where the blood vessel bursts and there's bleeding inside of the brain. Ischemic strokes make up about 87% of all strokes, and hemorrhagic strokes are about 10%. And then there's a 3% that's a special type of hemorrhagic stroke called a subarachnoid hemorrhage. And this is where a blood vessel bursts due to an aneurysm, which is caused by a weakening of the blood vessel wall.
And all of these are incredibly emergent, and if anyone's experiencing signs of stroke, they should immediately seek medical attention, correct?
Correct.
What are the symptoms of a stroke that people can look for?
So in general, they'll have signs of loss of some neurologic function. So the signs and symptoms of a stroke sometimes can be more subtle and difficult to recognize, but in general, somebody may have symptoms such as drooping of their face, slurring of their speech, an arm or a leg that becomes weak or numb or incoordinated. Also, they may have part of their vision that disappears or a loss of communication ability.
What are the actual risk factors for a stroke?
Good question. So the greatest modifiable risk factor is hypertension or high blood pressure. This we call sometimes the silent killer because people don't have symptoms from high blood pressure until later on. It does this damage over often decades, but significantly increases the risk for cerebrovascular and cardiovascular disease. And unfortunately, up to one third of people may not even realize they have hypertension. Other than that, there are high cholesterol, obesity, poor diet, sedentary lifestyle, smoking, excessive alcohol use, illicit drug use can be risk factors for stroke, as well as an abnormal heart rhythm called atrial fibrillation that some people may not realize they have because it didn't give them any symptoms, and it can come and go and not be present when a provider listens to their heart or does an EKG. And then there are also buildup of plaque that can happen in the blood vessels in the upper chest or the neck or inside of the brain that can increase the risk of stroke. And then finally, there's some other more rare causes such as blood clotting disorders, certain infections, trauma to a blood vessel, or some autoimmune conditions.
Now, some of the autoimmune conditions and some of the other conditions you talked about are genetic and can't be modified. Are there any other non-modifiable risk factors?
So age is the big one. So stroke does increase with age, and we haven't figured out how to stop that yet. And then, like you said, some genetic things we don't have treatments for at this time, but that might change in the future. And then trauma is something that while people can do their best to try to avoid risky situations, things like car accidents can just happen, and we just have to deal with it when that occurs.
Absolutely. So Sarasota Memorial is a comprehensive stroke center. What exactly does that mean, and why is it important?
So Comprehensive Stroke Center essentially means that Sarasota Memorial Hospital is able to care for the most complex stroke patients. There is an accreditation agency that looks at everything that we do every single year and makes sure that we provide the highest, safest, most effective care for every patient that may have a stroke. But of course, we look at every single stroke case that comes through the SMH system. So it's not just once a year type of thing. We literally work on this every single day. The Comprehensive Stroke Center will also have advanced imaging technologies, as well as patient access to vascular neurologists, neurosurgeons, and endovascular specialists. And we have this care 24/7.
What treatments for stroke are currently available as they come in to the Comprehensive Stroke Center? What does it look like if a patient is coming into Sarasota Memorial with a stroke?
So initially, when the patient first arrives, we want to evaluate them for any immediate therapy, something that we need to try to get them on board with within minutes. So if it's suspected to be an ischemic stroke, they'll be evaluated to see if they're a candidate for IV thrombolytic therapy. And what I mean by that is a powerful blood clot busting medication to help open up that blood vessel and restore blood flow to that part of the brain. If it looks like there's a blood clot that's blocked off a major proximal blood vessel, then we evaluate them for candidacy for a procedure called mechanical thrombectomy. That's a procedure through which a catheter is placed in through the artery of the wrist or in the upper leg, fed up to the brain. A device is deployed and grabs the clot, and we can pull the clot out, restoring blood flow to that part of the brain. If there's a hemorrhagic stroke, the most important thing is making sure their blood pressure is under good control. And if they're on a blood thinner or full anticoagulant, giving them the antidote as soon as possible. If there's an aneurysm that's the cause of the stroke, then medications and procedures will be used to block off blood flow to that aneurysm so it stops bleeding. And then they'll be monitored throughout the hospital course for all types of stroke. We also then watch out for complications that can occur from the stroke and treat those as they arise. There is rehab services that are provided to the patient through speech therapy, occupational therapy, and physical therapy. The secondary prevention of stroke, if we don't know why the stroke occurred right off the bat, if it's not obvious, we'll do some other testing to figure out why the person had the stroke so that we can tailor their medical treatment to reduce the risk of stroke as much as we can in the future. And that can include both pharmacologic and non-pharmacologic therapies as well as extensive patient education. And sometimes the secondary risk reduction may include procedures, such as a case where someone has a symptomatic carotid artery disease, where they might need a surgery to help reduce the risk of stroke.
How do you determine what type of stroke a person is having when it's not immediately obvious and time is of the essence?
Yeah, so the first thing we do is, for most patients, is do a very quick exam on their way to the CT scanner. And a CT is a fast, effective X-ray to see if there's any blood to start off. If there's no blood there, and they have symptoms consistent with stroke, then we evaluate them for those treatments for ischemic stroke that I mentioned. If need be, then we'll do a CT angiogram, which will look at their blood vessels in more depth to see if there's any blockages there. And we can use advanced imaging as well, such as CT perfusion or MRI. To further try to elucidate the cause of their stroke, we may do other things later on in their hospital course, like echocardiograms, cardiac monitoring, or other imaging modalities.
You talked about that advanced imaging and how that's imperative to be a comprehensive stroke center. Can you also talk about how important having that tool is as a vascular neurologist and in a comprehensive stroke center with all the neurosurgeons and the entire team?
Exactly, it's very important. We use advanced imaging in conjunction with artificial intelligence as well as protocols we developed to really try to expand the number of patients who might be able to get these therapies. For example, if someone has a large vessel occlusion, a very severe type of ischemic stroke, and they present outside of the typical window, we'll use this advanced imaging to try to see if we could still provide them some benefit for a mechanical thrombectomy. For other types of patients, sometimes people wake up in the middle of the night or wake up in the morning with their stroke symptoms. We don't really know when the stroke occurred, but it probably happened sometime close to the time that they woke up. We might take them straight to an MRI and use some MRI techniques to look to see if we can try to time the onset of their stroke to see if they're still a candidate for IV thrombolysis.
Can you talk about what Sarasota Memorial specifically has done to continue moving forward to try to improve treatment of stroke patients in this community?
So a big thing that is a plus for our community is Sarasota Memorial has a stroke system of care now. So that's made up of the Comprehensive Stroke Center in Sarasota, the Primary Stroke Center in Venice, and the freestanding Stroke Ready ER in Northport. So regardless of which facility the patient arrives first, they're able to have access to neurologists and stroke specialists to evaluate them for those immediate therapies that are steeply time dependent. And then if they need be, can be transferred to another center. We have excellent metrics as far as the time it takes for the patient to essentially hit the door to receive these therapies. And we literally work every day to try to shave a minute here or there to make that better and better. We've also hired several new excellent vascular neurologists to expand our complement and are implementing a stroke service so that we expand the number of patients that are able to have an interaction with a stroke specialist. And then also improve the outpatient access as well for people that have had stroke.
Sarasota Memorial also has a clinical research center, the Clinical Research Institute here. Can you talk a little bit about, we can't get into all of the specific trials, but there are also ongoing trials here constantly. And can you talk about the importance of having access to those trials here at a community hospital?
Yeah, we think that's very important. Some patients are really happy to be able to participate in some trials to where they can not only may or may not get benefit from if it's a drug trial or a device trial themselves, but they'll have access to it maybe before other people wouldn't, and they like to be able to contribute to the body of information to see if they could help another stroke victim in the future. And we have both trials for different medications that are coming online to see how well they work in a broader population, as well as non-pharmacologic trials as well.
And what about after a stroke? If a patient has had a stroke, is there a risk, and is it a high risk of strokes in the future?
There is a significant risk of recurrent stroke. That's why it's important for anyone who's had a stroke to be evaluated by a neurologist. Estimates that about 25% of people who have a stroke may have another one in the next decade.
What is your message to people who might be seeing this podcast or listening to it regarding how they might prevent stroke, or if they have a loved one they worry about, how they might be on the lookout for strokes?
Great question, because approximately 80% of strokes are thought to potentially be able to be prevented. So the advice I would give is to make sure that that patient or their loved one has a primary care provider so that they can discuss their vascular risk factors and make sure they're well controlled. Again, check your blood pressure for that patient. Try to avoid diabetes, or if they have it, they should make sure they work with their providers to make sure it's well controlled. Make sure their cholesterol is well controlled, exercise, eat a good healthy diet, don't smoke, or if they do, they should stop smoking immediately, and try not to abuse alcohol.
Dr. Stone, thank you so much for joining us today, answering all these questions. Is there anything else you want to add?
Yeah, I would just like to say that stroke is a medical emergency, and there are lots of things we can do to help treat strokes now. So if someone thinks they have a stroke symptom, they should not be shy about seeking help immediately. Unfortunately, many patients end up not being candidates for many of the things we can do for them because the symptoms are not recognized early enough. Some patients, as well as providers, may think that you have this window to be treated. And I don't think you should necessarily think about it in those terms. For example, there's a 4.5-hour window for IV thrombolysis for ischemic stroke. But we know that people who are treated within the first hour do much better than those that are treated later. Those patients are losing 1.9 million neurons every minute that goes by. So as soon as a stroke symptom is recognized, they should call 911. Likewise, for mechanical thrombectomy, even though we have up to a 24-hour window now with advanced imaging to try to carefully select patients and expand this treatment to as many people as possible. Obviously, those who have their blood vessel opened up earlier have a greater likelihood of doing better than those who have the procedure later.
And you mentioned earlier about even the physical therapy and rehab after a stroke. The sooner a patient is treated, maybe does that impact how long after the stroke they might experience issues that require treatments?
Yeah, so the whole idea of treating people early is trying to limit the size and extent of that stroke. And we know that translates into disability. Stroke is the leading cause of disability in the United States and in the world. So getting these therapy early on will give them their best chance for recovery. And then we want to have all the therapy services to help them on that road for recovery.
Thank you so much, Dr. Stone.
Thanks for having me.
And as always, we encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.